Hello, Chacruna followers. I am again. I'm Bia Labate. I'm chief editor at Chacruna.net. I'm in my beloved, glorious new hometown, San Francisco, and we are in the APA site. You can look up back there. Maybe you can show it to us. The American Psychological Association 2018 convention. And we just had a pretty historical panel on psychedelics. I think our filmmaker behind the scenes is Adam Snyder, who helped to put together the panel. I think that was the first panel on psychedelics, or among the first ones in a very long time. So this fact in itself, it's pretty awesome. We had some really kick-ass women participating on the panel, and we're all about women and psychedelics these days. So I'm here with another dear colleague, Adele Lafrance from Canada, and thanks for coming all the way from Canada to this special event. And can you tell us a little bit about what you do and your background?
So I'm a clinical psychologist, and I'm a research professor at Laurentian University. And up until a few years ago, I studied primarily different treatments for eating disorders, looked at emotion and its involvement in the illness. But about 4 or 5 years ago, I was introduced to the possibilities of ayahuasca and other psychedelics. And so I've been looking at qualitative explorations of individuals' experiences with ayahuasca who've also suffered from eating disorders, to get their perspectives on how it works, when it works, and also to kind of explore how ayahuasca is different from mainstream therapies, but also how it can actually work together with mainstream therapies. And so that was one of the things that we talked about today at the panel.
Yeah, right on. I remember when you started your research and you wanted me to put a newsletter getting people that had eating disorders to recruit them to the study. I'm like, what is this woman talking about? Ayahuasca makes you vomit. I don't think that people with eating disorders are going to be attracted. And plus, I've never heard of that. So I don't think that's, really a pertinent thing. That was my first reaction. So mea culpa. Here we are many years again later. And indeed, she followed that path and found out a lot of novelty and kind of unique stuff. But because this is like a kind of venue that wants to, talk to a larger audience, before we go into your research, why don't you just give us a very short intro about what is eating disorders for dummies? What kind of disorders are there, and what do we know about them?
Yeah, so DSM-5 includes a long list of feeding and eating disorders. The ones that we looked at in the context of our studies include anorexia nervosa, bulimia nervosa, and binge eating disorder. Each of those disorders involve problematic eating patterns that can cause medical complications. They also involve difficulties with the way you perceive yourself, so body image disturbances, low self-esteem are really, really common among all three of those classified eating disorders.
What is like the specificity of each one, or is that too complicated to explain?
No, I mean, with anorexia nervosa, the individual is engaging in restrictive patterns of eating such that it's seriously affecting their health or their development. Bulimia nervosa, simply put, there are patterns of episodes of binge eating associated with purging behaviors, different methods, whereas binge eating disorder is similar but without the compensatory mechanism. So that's really, really, basic. There are obviously some additional nuances, but one of the factors that we believe is related to eating disorders across the board is challenges with emotion processing and emotion regulation. And so somehow eating disorder symptoms serve to numb pain, soothe pain, provide emotional relief or relief from stress or distress.
Yeah, so just coming from that, I would assume that if these are like disorders that have a strong emotional component, that psychedelics in general, or ayahuasca in particular, could be potentially helpful, because it's not about exactly finding a virus to combat, but something larger, a more integral and holistic perspective. Is it kind of along those lines why you got interested, or better saying, why did you decide to do this study?
Well, a couple of reasons. One, in the context of my practice, I had a couple of colleagues who were talking about some recent deaths that had occurred among some patients. And like you said, having an eating disorder is not like having a virus or a cancer. And so it was really just so upsetting to think about the lack of efficacy of the current available treatments. And then I saw a documentary where Dr. Gabor Mate was featured, and working with individuals with really serious addictions. And I thought, okay, well, that could be a viable medicine. That could be something worth exploring. And so I did a bit more research, and I started to talk to people who had healing experiences. And just like you said, it seemed to operate via a number of mechanisms, but one of which seemed to be related to increased capacities for emotion processing, regulation, so that they didn't need to have or engage with symptoms to cope, regardless of the factors that influence the development of the illness.
Yeah, how interesting that, a documentary would sparkle your imagination. Kudos for that documentarist. That's why, I'm an advocate of research and an advocate of knowledge, and people say, what does that matter, or why are you doing this? We don't know the results of, what we put out there and how it influences people. That's just a side note. But tell us more, what was the study like? How many people? What was the...
So there were two main studies. Both were qualitative in nature because of the challenges associated with studying substances like ayahuasca. So we recruited about 22 individuals who had experienced ayahuasca and a history of eating disorder. We narrowed that down to 16 individuals who had diagnosed eating disorders by recognized, medical professionals, so that it could be grounded in that framework. And we asked them, how did it help you? If it did, if so, what was your opinion about how it worked? And were there any risks or challenges? And would you recommend using ayahuasca to other people? And we got all kinds of really interesting information, including about the purge related to ayahuasca and how that might influence individuals with eating disorders, as well as the restrictive diet. So we took all that information. We wrote a couple of papers. One of them is published, another one in press. And then the follow-up study, which we hope to publish soon, looked specifically at those who had experiences with conventional treatment methods in North America. And we asked them to compare the experiences with ayahuasca, and to kind of talk about how they were the same, how they were different, how they complemented each other, and how we could learn from one another.
Yeah, great perspective to think also comparatively, because the treatments available with psychedelics, they have to be thought within, what are the other alternatives. So it's maybe not necessarily about a panacea that this is going to heal everything, but look, considering that we don't know how to treat this conditions, we might as well experiment a little bit, into other directions that we're less comfortable in. But anyway, can you just give us a quote or a story, or something that caught your attention from all those narratives that you collected?
Yeah, so there was one woman in particular. She was in her 50s, and she had engaged in all kinds of conventional eating disorder treatments that she found to be helpful, actually, to varying degrees and at different points in her life. But she still was left with a baseline of symptoms that affected her everyday life, and that she felt she was going to have to live with forever. And we highlighted one of her quotes because she said, after all of these years of living with these symptoms, I never thought they would go away, and now they're gone. Like, literally the symptoms are gone. Now, that is not everyone's experience, and people talked about risks and challenges, but on the whole, individuals reported positive changes with respect to their eating disorder symptoms or associated comorbidities, their relationships with other people, their connection to spirituality. It took on a life of its own. I never expected to hear about all of these different positive outcomes, that people were experiencing.
And I know that, it's only a scientific research, but maybe in the back of your mind, do you have like a personal theory of what's going on? Why does it help? What is it? Because people have visions, or they have encounters with like supernatural beings, or is it accessing the memories? What do you think? Why does it work? Because we know that it works for so many different conditions, for so many different people. I witnessed. I've been drinking ayahuasca for 21 years in all over different contexts. And I've seen it personally. So many people give so many strong testimonies. What do you think is behind all of that? Do you think it's magical power, it's chemical substance? What is it?
Oh my gosh, to be completely honest, I don't know. I can provide some hypotheses about why, but one of the things I've learned is that we have a lot to learn, and there are some things that we just can't even hold on to in terms of understanding the bigger picture and how this substance works to heal. I have a couple of thoughts. One is that sometimes when you're under the influence of ayahuasca, you cannot control what's coming up for you. And so in a way, you're primed and positioned to face some pain that's causing you a lot of distress in your everyday life, whether consciously or not. And so unpacking that pain, working it through, I think leads to some pretty amazing benefits subsequently. I also think that the increased likelihood of expanding one's own awareness of their place in this world, including a connection to spirituality, can lead to really positive effects. That was perhaps one of the most surprising findings actually for me, was the power of spirituality and healing. So it makes me realize we have to kind of look at the integration of spirituality across different modes of conventional psychotherapies, but there are many more: emotion processing, healed relationships, but I'm still learning myself to understand how to put this data into context.
Fabulous. I like that. I like that quote. We're here learning on how to learn. So I think that psychedelics teach us to learn, to be open to knowledge, and to be open to new ideas and new modes of learning. And it's fabulous that we are in 21st century in the APA convention, mainstream, downtown San Francisco. Check out the view around, fancy downtown area, and talking and blogging about things that we care and that we love. Thank you. Congratulations for your bravery on risking your career with an exotic topic. Keep on tuned and follow us on Chacruna. Big hug from Bia from the APA.